So how do we go about using the massage guns? Now, this is the HyperIce HyperVolt Pro. This is the HyperVolt 2. Both of these are equipped with the HyperIce heated massage tip, which is battery operated and rechargeable. It feels absolutely amazing, warms up really nicely if I'm trying to increase circulation, down-regulate some muscle tone a little bit more with some heat. So temperature can be a great way of us working on things, not just by percussing it and vibrating the tissue. Now I'm going to teach you how I go about working on vibration and percussion therapy with the guns. So let's start off with the quads. It's one of the easiest muscles to use the gun on. So let's start there. We're going to start at the insertion where our vastus medialis, or the most inside quad, attaches on the knee. We're going to turn the gun on, turn the dial so that it turns on, and then we're going to get started. We're going to work all the way down towards the insertion. Again, staying away from bunny prominences. Don't want to get on top of that kneecap. And then we're going to work away from that in little bitty kind of small segments. I like to work in, 2-ish to 3-ish inch segments, just so I can kind of keep that tissue up. And I love to work back towards where the origin is of that muscle. So we're going to work all the way back up, going towards where that muscle ends up. Now, you're not going to always make it to the actual origin or the insertion points on these muscles, and that's fine. So we have 4 quads, by the way. So this is medialis, rectus femoris, and vastus intermedius is going to be right dead center. We're going to be working that same distribution. Sometimes, by the way, a little pro tip, I'll take my hands and I'll help guide it. So I'll use 2 hands. Sometimes I'll hold it choked up like this with 1 hand, and I'll just kind of work my way, again, from that insertion back towards the origin. And we don't have to apply so much pressure that the gun begins to stop. It's whatever pressure feels comfortable and feels good. That's how you want to use your massage guns at home. Lastly, we're going to get over here to this vastus lateralis. I'm going to turn my leg a little bit so you can see it. Again, insertion on the lateral or outside part of the knee, and we're going to work up. Now, lateralis is pretty big, so we're going to have to work way up on this one. Again, working our small little segments going up, but lateralis goes way around the thigh. So we're going to encompass a whole lot of geographical area on the leg. This is still vastus lateralis back here on this part of the leg. Some of you may be thinking, I'm getting awfully close to a hamstring. Well, it kind of does cut behind your lateral hamstring as well. Again, working from that insertion point, going back towards the origin. And as we come up, we're going to want to taper it back in because that's where that quad runs up to. So that's how you're going to do your quads. All right, one of my favorite areas to use the massage gun on is actually my glutes, specifically gluteus medius and gluteus minimus. Maximus, I don't really do very much, but I do glute med and glute min quite a bit. So what you're going to do is, again, turn that dial, get it going. I'm going to lay in side lying so you can see pretty good. And you can let it be on a stretch a little bit with the hip up. This is fine. Again, we're going to work from insertion. It goes over here and attaches over onto the outside part of my hip bone over here and works its way back up towards the iliac crest. So we're going to start from here, and we're going to, again, work little small segments, working back and up in this whole area. Now, for our glute med and glute min is very deep, so we're going to have to apply a little bit more firm pressure while we work on glute med and glute min so we can get all the way through. The other thing about glute med and glute min, which is interesting, is there's actually a nerve that runs through it that can cause you to have pain down your leg. So some of the pain that you've been experiencing down your leg isn't because of sciatic pain. It could actually be because of a nerve in your hip, which is the superior gluteal nerve. It runs right in between 2 of your glute muscles and goes down your leg. So working on this area can be really beneficial if you have issues where you have pain that's extending down your leg, particularly on the lateral aspect of your leg. So again, insertion, back towards origin, 2 to 3 minutes here on this one. But this next one is for my folks that have shin pain, particularly shin splints. We're talking about what is called the anterior compartment. Now, what we want to do is find the bony prominences, especially our fibular head. This is equivalent to the funny bone of the legs. We don't want to hit the nerve that's over here. It's our fibular nerve. It'll shoot right down your leg. It can be very painful, and you can actually damage the nerve. So be very, very careful here. If you're not sure of where to go, talk to a medical provider on this one. We're going to get the gun going. I like to use a towel on this area, but I will, again, mark out where my bony prominences are. So I'm going to find that fibular head, find the tibial tubercle, and we're going to put our fingers there, and then we're going to work our way going down, or working our way up, that is. So we're going to start going towards the insertion, and we're not going to make it all the way to the insertion on this one, because the insertion is actually on the foot. It becomes a tendon, a very long tendon goes down into the foot, so we're not going to do that on this one. We're going to start working down the lower leg and work our way back up, okay? And you can put your finger right on your shin bone. It's a really long bone. It goes straight down the leg, kind of like this. And then we're going to work our way back up towards the insertion. Now, this particular muscle runs on the front/outer part of the leg. So you're going to want to come up this direction as you're coming back up, okay? Over here is going to be our calf muscle, so our soleus and gastroc. We'll get to that in a minute. Working from down here all the way back up. This is a great opportunity for us to get some vibration in through the tibialis anterior, which does have another nerve that passes through it, much like our glute muscles in the back, the glute med, glute min. It has the articular branches of the fibular nerve, which can cause us to have a bit of pain shooting down the leg at times in our lower leg. So if you're having lower leg pain, this might be a good area for you to work on. When it comes to the calf, this is a very large muscle. It does plantar flexion, so it gives us our push off. We also have a couple of other muscles that are on the inside part of our leg. So we're talking about the medial compartment here. We've already done the lateral compartment. Now we're talking about the medial compartment of the leg. We're going to again start towards where it inserts and work our way back up into the calf. Be very careful here. There's a very superficial nerve here called the saphenous nerve that becomes very, very, very close to the skin. So we don't want to really irritate that. So we're going to go pretty light here on this one to start and increase pressure as it feels good. So again, starting down towards where it inserts, we're going to do a little bit of back and forth, about 1 inch or 2 inches, and then begin the process of working our way back up towards the origin. So again, going from insertion back towards the origin. If you've had any blood clots in this area, you need to talk to your medical provider about this one. Just for the record, you definitely want to talk to a medical provider and see if this is an appropriate thing for you to do. It may not be, so definitely talk to your medical provider and see if that is okay for you to do this one if you've had any deep vein thromboses in your leg, okay? This one should feel really nice, especially if you stay really superficial. It should feel really nice. Again, I'm marking out my bone with my fingers here so that I don't hit the bone on the way back up. All right, last but certainly not least is the medial compartment of the upper thigh, also known as the adductors. If you're dealing with hip pain, this one can be a tremendous area for you to work on because these adductors do affect our ability to rotate the hip, to allow the hip to move up into flexion. It can cause a lot of pinching at the hip. So it's a great area for us to work on. Now, when it comes to the adductors, we're going to take our gun. We're going to work again from the insertion point back towards the origin. Insertion point on a lot of these is going to be right down here, just behind where the joint line is. We're going to be just off the edge, and then we're going to work our way back up. Again, about 1 inch to 2 inches at a time. Again, if that skin feels like it's getting kind of stuck on you and it doesn't want to glide, grab your towel, put a towel on top of that so that you can have it glide a little bit easier for you. Use your heated massage tip if that helps make things feel a little bit better as well. Now, while you're going on this one, we're going to work a little bit more towards the back side of the thigh. If you saw how I kind of dropped down and towards the back of the leg here, and then I'm working my way up, you're going to work your way up towards the insertion. We're not going to make it to the insertion on this one because the insertion here is on the pubic tubercle, which is right in the midpoint of our body, and you can't really put a massage gun there. There are a lot of things that are a bit sensitive in that area, so we don't really want to get in there with that. Take your gun, again, working 1 inch to 2 inches at a time, all the way up as far as you're comfortable, and then we'll work our way all the way back down. Hey, if you made it this far, I just want to say thank you for watching this video all about using a massage gun. This one in this case was the Hyper Ice. I used the Pro the whole time. You can use the Hyper Ice Go, the Hyper Ice Hypervolt 2, whichever one you like. They're at different price ranges. They're all great guns. I definitely recommend the heated massage tip. If you want a quick link to those, I'm posting a link for that down in the description of this video, so you can go straight on over to Amazon and pick that up if you'd like that one. If this has been helpful for you, go ahead and hit the like button, hit the subscribe button. Let me know what you thought about this. Let me know if there's anything that you need help with so that I can create more content for people just like you. And go ahead and share this with somebody if you found it helpful. Shoot it to a friend or someone that might benefit from a video like this. Thank you guys, and I'll see you next time.